Hi, I'm Megan Swanson. I'm one of the GYN oncologists here at UCSF. Welcome to our virtual symposium this year. I have a particular interest in cervical cancer, preventing and treating cervical cancer, and I wanted to spend a few minutes talking to everybody today about immunotherapy for advanced cervical cancer. I have some slides that I'm going to be looking at if you see my eyes looking down, and you'll have these slides in your virtual gift basket if you want to reference them, and there'll be a little bit more detail in the slides than I'll go over verbally. But to give you guys just a bit of background, what I'm talking about today is mostly advanced cervical cancer. This is cervical cancer for which there's no curative surgery and for which there's no curative option of radiation. So this is specifically either cervical cancer that's come back after one of those types of treatments or cervical cancer that started off very advanced in diagnosis. So at this point, the problem is we have very limited options with chemotherapy. Our very best combination of chemotherapy, you guys have heard of some of these agents. We use cisplatin, paclitaxel, and bevacizumab. Our very best combo really doesn't work that well. We're looking at response rates of really only about 50% to that combination. And survival that's really not good enough. We're looking at a median survival with just that type of chemotherapy alone of really just about 1.5 years. So it's for those reasons that we want to do better and find better treatment options for our patients with advanced cervical cancer. And that's why immunotherapy has risen as an area of interest specifically in cervical cancer. Part of that is because almost all cervical cancer, as some of you probably know, is related to HPV infection. So prior HPV infection of one of the, more commonly of one of the higher risk strains, HPV 16 or 18, that's higher risk for integrating into the host, which would be us, integrating into the host genome and then overexpressing these oncoproteins that are E6 and E7. So because of the way cervical cancer develops, immunotherapy is specifically an area and a therapeutic area of interest. There are kind of 3 categories of immunotherapies that I'm going to just briefly touch on today and give you guys an overview about. The first is active vaccinations. The second, called immune checkpoint inhibitors. And the third is a concept called tumor infiltrating lymphocytes, okay? So most of us, when we've heard about vaccines in the context of cervical cancer, we're thinking about the HPV vaccine, okay? And by and large, that is the prophylactic vaccine to prevent HPV, okay? That's given ideally before the onset of sexual activity. It's essentially 100% effective at preventing HPV infection when it's done at that time. Unfortunately, uptake in the United States is only about 50% of eligible preteens are getting that, but that's kind of where we're at with that. That's not what I'm talking about here. That's the prophylactic preventative vaccine for HPV. This category of treatments for advanced cervical cancer are active vaccines. So it's a little bit different. This is somebody that already has the problem, and the idea is to give a treatment that's going to be to induce immune response specifically against that E7 oncoprotein that HPV and the cancer has overexpressed. So very limited data at this point on the clinical efficacy of these types of vaccines, so kind of stay tuned for that. Some encouraging data in the preclinical phases, and there's multiple trials going on looking at these, so kind of stay tuned for that, but we don't have any actual clinical data. That's not exactly the standard of care at this point. Second category, immune checkpoint inhibitors. They come in a few different categories, and you'll see in the slides that you have access to, there's a diagram that shows really well the interaction of cancer cells and immune cells. And the whole idea behind immune checkpoint inhibitors is that those drugs are able to block the cancer's ability to turn off the immune system. So if you block that interaction, then the immune system can stay online, so to speak, and hopefully work to fight the cancer. There's a few different categories of that. The one that just got FDA approval is called pembrolizumab or Keytruda. That now has FDA approval for treatment of advanced cervical cancer. And while the response rates are not quite as good as with chemo. What's really exciting about this is that the duration of the responses seem to be really long lasting. So that's pretty exciting that we have this new medication on board. There's a different class of immune checkpoint inhibitors called CTLA-4 inhibitors. And we have a current study open at UCSF. It's the GOG 3028 trial that's comparing this combination of two different immune checkpoint inhibitors to just that PD-1 inhibitor that's FDA approved to see what's better. So stay tuned, we'll find out, and we're a part of that clinical trial at UCSF. So we will see if actually using two different immune checkpoint inhibitors it actually outperforms just using the one. There's also, because there's been this preliminary interest in immunotherapy, specifically the immune checkpoint inhibitors, there's also been some interest in a question about whether or not would it help the chemo work better to add a checkpoint inhibitor. And there's two big trials. We don't know the answer to it yet, but there are two big randomized multinational trials that are looking at this. One is the Keynote 826 trial, for those of you that keep track of the numbers, and the other is called the BEAT-CC, it's like beat cervical cancer. And both of those trials are looking at adding a different type of immune checkpoint inhibitor to that backbone chemotherapy with Avastin. So we will see, stay tuned. Maybe in the future, immunotherapy will be part of the upfront treatment. The last one is tumor infiltrating lymphocytes, which is an exciting new type of therapy that extracts tumor infiltrating lymphocytes from the tumor, expands them in the lab, and puts them back in the patient. We have very early preclinical data, which looks promising, so stay tuned. And that's kind of an overview to immunotherapy and the treatment of advanced cervical cancer. So those are the different pathways we're investigating, and we're doing some of that here at UCSF, and hopefully we'll know more in the coming years, because ultimately we all want to do better at providing more effective treatment options for patients with advanced cervical cancer. Thanks.